if we move down to level 4, which we will do by Friday, and we do not stick to the conditions, to the restrictions, to the public health conditions, and the virus starts speeding up in terms of more people getting infected faster, the government will have no option but to move very swiftly back to level 5. So it doesn't mean that if we move to level 4, if we stick to all the things that need to be done, all of us collectively, then we may be able to hold on level 4 and eventually get to level 3. But if we don't, whether it's individuals, collectives, companies, because if companies also don't stick to what they are supposed to do, and the infection in a company, the company might close. And if the numbers go up, we go back to level 5. If the numbers remain stable, we may remain to level 5, and if they start showing a decline, we may go to level 3. So it's all in our hands, South Africans. Depends on what we do, whether we stick to what we are supposed to do or not. So we must make that choice ourselves. So there are things that are going to remain in place, and I want to put those up front so that we understand that it's still a lockdown, but an easier lockdown. So things like interprovincial travel will still not be allowed, except under exceptional circumstances, like people returning to work if their sector is open or their company is open, or people going to funerals under strict conditions. So interprovincial travel is still not allowed. Or people coming back to school, universities when they do open. But other than that, you remain where you are. You remain at home, except if you are going to work or you are going to buy essential goods or you are going for medical. Visiting is still not allowed. You can not visit your friends, visit your neighbors, visit your relatives. That is still not allowed. Exercise will be allowed, but under very strict conditions. Things like gyms will remain closed. Organized sport or walking or jogging is not allowed. We will put very strict regulations under which exercise can be done. So I just want to put that up front, that it's not the end of the lockdown, it's the easing. It's the risk-adjusted approach. It's not just lifting the lockdown. But because we need the economy to start working and the wheels of the industry to start grinding, we are opening, and Minister Patel will explain how this will work. But let me just show you also where I've said about this, but I think having said all this, our approach should not be that we should not feel overwhelmed by all this, but instead we approach this coronavirus as a challenge to be met by all of us collectively and not a threat to be feared. And we must meet this challenge collectively. So I would also just want to move to maybe explaining where the country is in terms of the infections. You'll see a map of South Africa with different colors. and numbers. The numbers are just the districts or the metros. We've allocated every district and every metro a number. But the colors are the ones that we must watch out for. The red ones, the red spots, you can see a little red spot around Cape Town. You can see a little red spot around Nelson Mandela Bay, a little red spot around the Buffalo City Metro. You can see a red spot around the eThekwini. You can see a red spot around Gauteng, especially Joburg and Ekurhuleni and a bit in Pretoria. You can see a red spot in Mangaung. Those are where the numbers are biggest. We may say those are the epicenters. So that is why we do not want, and we are still restricting interprovincial movement. Because if you move from Cape Town, where the epicenter is, or Gauteng or eThekwini, and you keep going home, which may be in the Eastern Cape or KZN or Limpopo or Northwest, every weekend you keep going, you may be taking the virus to places which do not have high numbers. And if we keep moving interprovincially, we may end up with the whole country being red. And that's not what we want. And that's why we limit the interprovincial movement. It's the same as we limited the international movement. We closed our borders because people were going in and out of other countries, were bringing the virus, or people were coming to visit us, were bringing the virus, even unknowingly, and then they tend to be positive and they spread. Now we've closed the outside borders. Now our boundaries within our provinces may act like that as well. May act like that if we keep coming to Gauteng and back, or eThekwini and back, we may be spreading the virus in areas where the virus is not so much. So we must understand that every action that you are taking, what is underlying is trying to cap the accelerated spread of the virus. So as you can see, the orange parts are also parts where the spread is there. They are second to the red spots. The yellow parts are third to the red and the orange spots. And then the blue are fourth. They are number 4 in terms of the spread of the virus. So I think that shows you exactly where we are. So the whole country is going to be level 4. But there may come a time where we would differentiate the levels. There may come a time where a particular area may be on level 5, while other areas are on level 2 or level 3, as you can see those colors. But for now, we were all on level 5, and we are all going to be on level 4. So that must guide us. So it's important then to remember that the lockdown will continue even under level 4, but it will be easier because those who will be going to work, there'll be more going to work than in level 5. But because we still have the lockdown, there will even be a curfew. The curfew means when you come back from work, you stay at home. It doesn't mean that now that some may be working after work, they can go everywhere. You come back home. And we will explain, when you go to work, the sanitizers must be there at home or washing of hands with soap all the time. When you go to work, you must sanitize. When you enter transport, sanitization is important. But when you leave your house, you must have a cloth mask. It's mandatory. It's going to be mandatory to use a cloth mask as you step out of your home, going anywhere. Now, we know that these masks may not be easily available for now. But if you don't have a mask, you can use a scarf to cover your nose and mouth. You can use your T-shirt. On the health website, they also tell you how to make your own mask at home. So you'll have to have your nose and mouth covered in public. Thing that we must understand. So nobody should say, no, I couldn't get a mask. The surgical mask and the N95 and all those masks will leave for the health workers who are in the front line, and maybe people who deal with mortuaries who are also in the front line. But for all of us, a cloth mask. Homemade, bought. If you don't have, you put whatever you have. My scarf here can be a mask. So nobody should have an excuse. And I had a cloth mask, it's only because SAPC said they couldn't hear me properly, so I had to take it off. But anything that covers you protects the others. When you cough or talk, you are protecting the others, but you're also protecting yourself from their droplets. So let's do that as we go to work. Social distancing is critical. At home, outside, at work, even those companies that are going to open, they must observe all these health imperatives. If they don't, then they shouldn't open. And that's why it was said before they open, they must send a team, a small team, that's going to go there and make preparations for all this. And it's critical because industry must stick to the guidelines. Because if you take shortcuts and maybe trying to save money, you may lose more money when that company or that factory has to close because there are people who are infected. They must be screened for temperature, for cough, for any symptoms, flu-like symptoms, the symptoms that we know are related to coronavirus. And if any of the worker has those symptoms, they can't work, but they must be tested. So screening every day when people come to work is very important. For the protection of the workforce, for the protection of the people you interact with, because if you go to a supermarket, you interact with people there. So it's for everybody's protection. The masks are important. Social distancing is important. So we must just stress this. And what we want to see the whole country being blue or even further than blue. Further than blue, it will mean there is hardly any infection and life goes back to normal. But as long as we have those red spots, and remember that those red spots are where the majority of the population is. They may look small, but that's where the concentration of the economy is, in those red spots. But more than that, that's where the concentration of economic activities are. So it's a big challenge to balance because that's where the infections are, but that's where the biggest number of the population is, and that's where most economic activities are. So it's very important that when we open up the economic activities a bit more, the strict adherence to health, public health instructions is adhered to. The question of gatherings, social, cultural, religious gatherings are out. Weddings, they are still out in level 4. The only exception is still the funerals. And of course at the workplace. But other than that, gatherings are still not allowed. And as I